I'm Mike Reardon, President and CEO of Greenville Health System. We are pleased to sponsor the 2015 Healthcare Transformation Award. GHS has been committed to supporting the health of our community for over 100 years, and our vision to transform healthcare for the benefit of the people and communities we serve is reflected beautifully in the core intention of this prestigious award. It honors an outstanding individual or entity who actively and compassionately works to transform the health of our community through contributions of time, talent, and treasure. It is my great pleasure to present this year's award. Congratulations.
So the school in Greenville actually was established in order to help transform healthcare. And it really relates to the relationship between the Greenville Health System here in Greenville and the University of South Carolina. The goal on the healthcare delivery system side is actually to progressively start providing healthcare instead of just good medical illness treatment. So for a very long time, the system has been excellent at taking care of you if you were sick or injured, but before you get sick or injured, or after you get sick or injured, you're pretty much on your own, not just here, but across America. And so our goal in the healthcare delivery system side is actually to get involved with the community in helping people take care of themselves, try and have good prevention, good nutrition, good exercise, wellness on the front end to keep you out of the emergency room and out of the hospital. And then if you do become sick or injured, take really good care of you. And then after you go home, to continue to work with you again through the community resources in order to return you to optimal function and health. So we actually are already seeing fruits of all of this. We're getting ready to graduate our first class next spring. We are seeing some real substantive examples of change.
He really looked at, how do we bring sort of the delivery system, the hospital, together with medical education. In so many communities, it's separate, and then we sort of hope that links up later. But Jerry was committed to sort of overlapping and interweaving them together so that we could have the best clinical physician to work in the best clinical environment. So he's meant a lot to the School of Medicine, and he's meant a lot to me personally.
There were many times, frankly, in the development of the school that we questioned whether we could make it. There were all sorts of issues in terms of physical facilities and budget and even political. But Jerry was the one who said, let's go. Let's get up and go. We've got to do this.
Your most important responsibility in a leadership role is actually to help all those people that you're working with that are supposedly working for you, that I actually see myself working for, to help them be functional so you can leverage your own goals by having others work for you toward the good of the patients and the community. All in all, Greenville and the upstate of South Carolina is the neatest place I've ever lived. I'm a poster child for the chamber when I recruit students, faculty, and so forth. And as a giving community, so there's two aspects to that. Number one, the community of Greenville is generous. Equally important is the business side of the community. And of all the places I've lived, many of them are able to establish a vision. Very few of them are able to implement the vision. And Greenville, when you look back to the 50s and 60s, where it was, where it is, the generation that started that, the generation that picked it up has been incredibly driven and successful to make this a better community. And I think that probably is at least as important as the charitable aspect of things. And so it's just a neat place to be.